For this week's presentation, we are touching bases on policy and politics of health. As we know, there are many examples of healthcare policies, but in this presentation, I'll be touching bases on a few very important ones. Examples of healthcare policies include patient care policies, drug handling, and also employee health and safety policies. Um, Patient care policies are very important, as some may say a one size fits all. However, this does not work for patient care policies as every facility needs are different based on the type of care it provides. Whether the facility is a multi-state hospital, a small family practice, or even a regional rehab center, the facility should have specific policies that cover in which care is being effectively provided for patients. For example, effective policies should address what types of procedures the facility performs, what type of illnesses and injuries the facility treats, and also when to refer patients to other facilities and when to transfer them. More specifically, patient care policies explain how to handle particular medical situations, of course, such as exposure to bodily fluids or even medical emergencies. Regardless of the organization's size or type of care provided, a good first step with patient care policies involve asking key questions that relates to that specific facility. Another very important policy that really is instilled into healthcare is drug handling. This is because it has to be known what type of procedures and safeguards are being put around drug handling. Many facilities do not carry medicines in-house, while others only carry over-the-counter drugs, and still more carry very controlled and regulated drugs. Regardless of where that facility falls on the spectrum, there are very clear policies on how to usually administer medication, how you can record it, chart it, and what to do if an error occurs, or of course, if inventory goes missing. In terms of employee health and safety policies, it makes sense to include a variety of policies because this covers your biggest assets, which is employees. As the number one resource of any healthcare facility, employees need and of course deserve policies that look out for their health and safety on the job. This holds especially true because healthcare professionals face much greater health risks compared to most other industry professions. Hint, for example, just like now, dealing with COVID-19, it is important to have these policies in place to ensure employees aren't being exposed to COVID from their patients. So this is, having proper mask or wearing proper equipment when dealing with the patient with COVID or having face shields. Of course, depending on the specific healthcare facility, there may be policies that cover issues such as personal protective equipment also. And this could just be when do they need to wear gloves, mask, or, even more. Um, Exposure to substances like chemicals, infectious agents, or drugs, and any physical hazards in and around the facility. Policies and procedures can help make employees aware of less hazards and protect their health, but beyond that, there's also overall wellness for the staff. Having programs and policies to promote and protect their wellness is also very important. Wellness policies usually address concerns like weight loss, work stress, healthy eating, and even on the job like breastfeeding. All of these contribute to a very, very healthy workforce, which research continues to prove it is better and provides a more effective workspace. Moving on to importance of data privacy and security, it is important to have data security for protection of both patients and the organization. Um, It's very important increasingly because data privacy and IT security are connected in terms of hospital policies and procedures. The more technology facilities incorporate into their facilities, the more risks they face for data leaks or privacy breaches. At the core of these leaks, it is primarily human error. This is why it is important to crucially put in writing, these security and privacy policies so these facilities won't have these issues. It can really help facilities avoid a costly error. For example, the consequences of not complying with HIPAA could mean losing tax exempt status by failing to comply with new requirements from the Patient Protection and Affordable Care Act, or non-compliance could also mean facing a really, really big fine. According to HIPAA resolution agreements from the Department of Health and Human Services Office for Civil Rights, HIPAA fines can be up to 1.5 million per incident per year. Now that we have an idea of why it is important to have data privacy and IT security, we will now touch bases on why politics also play a crucial role for better or for worse in healthcare. Um, Health, like almost all other aspects of human life, it's political in numerous ways. And it's very important to understand in terms of health. Health is political because its social determinants are amenable to political interventions and thereby depending on political action. Um, this really just means that, making sure um, that health is available to all. Health is political because, like any other resource or commodity under a neoliberal economic system, some social groups have more of it than others. This is shown from many different things, just like Medicare and Medicaid, or even right now we're dealing with COVID-19. Um, it's really important to realize, who is really having the access to care, who gets to they're sick, go to the hospital, or being taken care of. But this is when politics come into play. Um, it's important to know how politics affect health, especially in times like this. With COVID-19 today, with more than 160,000 American lives lost due to the pandemic and 5 million confirmed infections, the risk remains that not only will the health be felt by inequality, it just has, but also the recovery itself will be just unequal with widening gaps across various different fronts, which includes educational attainment, income, employment status, race, community wise, like all those things play a big role in the politics of health. Um, the government plays a major role in healthcare by financing, by mobilizing, necessary resources through public budgets and other contributing mechanisms like pooling resources allocated to health development, guiding the process of resources, and also purchasing health services from various providers. Um, the areas of, health are very important to the government because they're supposed to ensure an adequate local public health infrastructure. They're supposed to be promoting health communities and also healthy behaviors, and also preventing the spread of communicable diseases. In which, just like I said, in times like this, we've clearly seen how that has failed America and its people as a whole. So that's why it's very important to really know and grasp, politics and why it's important to our day-to-day actions or even just our future. Health is just very political, like I said, because it just its social determinants are very important in political interventions and are thereby depending on political action. who gets what, are vaccinations going to be mandatory for everybody, which is one of the photos here, and it says, am I my parents' child or the government's child? Basically, like, if the government tells me I have to get this vaccination, why is that? But these are all just very important roles that affect healthcare in politics.